Welcome to The Margin Line, a dental business show by Dandy. Dr. Pasco, thank you so much for joining us today on The Margin Line. We're so excited to have you, your expertise in not only dentistry, but the business world of dentistry. Our audience can't wait to hear all of the wonderful things that you have to share with us today. And what brought you into dentistry?
Oh gosh, that's a long story. I actually didn't want to be a dentist. I wanted to be a veterinarian, then I wanted to be an artist, then I wanted to be a heart surgeon, and I was going in that direction. And I had a dental appointment, and the dentist was rather cute, and he asked me, did you ever think about being a dentist? And I was like, ew, that's disgusting. No way. And and then he said, well, I think it's a great profession for women. I see that you're studying a medical book. It's probably better than, full-blown medicine. You're not on call and all this other jazz. And then he offered for me to come in and watch. That was during the cosmetic days. And I fell in love because I have a very artistic side to me, but I also have a very scientific side to me. So I felt that those two really blended together. And that's how I got into dentistry.
I love those stories. That's great. Tell me about dental school. What was that like for you?
Oh my gosh, it went by so fast. It was just very eye-opening for me because I lived at home all my life. So it was my first time ever away and living on my own. It was a great experience. Yeah, I loved it.
Where did you go to dental school, Doc?
University of Pittsburgh.
Hail to Pitt. Awesome.
Hail to Pitt.
What are some things that when you walked across that stage that day that you said, all right, look out, world, here we come. This is what I'm going to do.
Dental school was a whirlwind and we did learn a lot, but it wasn't a ton of hands-on. And so I was very fortunate. I had a great associateship along my way before ownership. And I learned a lot through there too. So I'd like to tell you, Barry, that, I was ready to conquer the world and there was not a fear in me, but I was scared to death. I was the first doctor in my family too. So, so I didn't have anybody to seek advice from. So
right, to kind of lean on or mentor from. Right. Okay.
Exactly.
Okay. What would be one thing that you would tell a new dental graduate? Hey, you need to know this.
While you're in dental school, it's really important to learn the technical side of dentistry. But what I would suggest, and what I didn't do until after dental school, several years later, is learn what makes people tick, to learn how people think so that you can better communicate with your patients and your staff, especially these days. I pick up tons of books, anything that I could read about how to better improve my communication with people.
Was that from the school of hard knocks that you kind of slid into that? Or like that was a mission that, I need to communicate better? Kind of walk us down that pathway. I think our audience would want to know that.
When I bought my first dental practice, it was a very old dental practice from the 1970s. And everything in that practice was old, including the dentist and the patients. And I was young. And
right.
I really didn't understand how to relate to the patients in that practice. And no one ever taught me that in dental school or anywhere else. And the trouble I was running into is every time I would walk into the treatment room to do a checkup, the patient would think I was just another hygienist. Yeah, they didn't take me seriously. Consequently, because of that, my staff weren't listening to anything I said either. I was having a really hard time, Barry, even to the point where I had considered selling that practice after about a year and a half and going, into the family restaurant business or something, or working,
Sure.
at the school as a teacher. I was really, ready to give up. And when I changed the way I thought and the way I approached my patients listened. They respected me as the doctor. They did exactly what I said. And so did my staff. And the whole thing, it didn't happen overnight, Barry, but it took time. And, it produced results that kept me in dentistry and having a really fulfilling career, because as a dentist, we want to help our patients. But if we can't communicate right with our patients, then the patients make all the decisions and all the choices and tell us what to do. And that's not really what we're in medicine for. So it really changed the trajectory.
So you went from the 70s, if you will, the 70s style practice. Then you went where?
Yeah, the practice grew really, really fast. And once I learned how to communicate with my patients and I told them, this tooth is sick, it's cracked, It's broken. I can't patch it anymore. It needs a crown. They said, okay. And I started doing the type of dentistry I wanted to do. I was really happy. I wanted to continue in dentistry. My practice grew very rapidly from 3 operatories to 6 operatories, then from 6 operatories to 10 operatories, and then from 10 operatories to 18 operatories.
That's like the size of a football field. Are you kidding me?
Yeah, but Barry, wow, that's what happens when you do the right thing and you do the dentistry that you're supposed to do for your patients. Your practice just organically grows. When you cut back the treatment plan, you tell a patient that they need 3 crowns, and they say, "Oh, doc, my insurance only covers 1. Can you do 1 this year, 1 next year, 1 the year after?" What that does, Barry, is it instills a lack of confidence in the patient if you agree to that, because then the patient is left to wonder, well, if I really needed 3 crowns, why is he doing only 1? Did I really need those 3 crowns, or do I really just need this 1? And so the practice doesn't organically or naturally grow because you're not building trust with your patients. You're actually building distrust. And then patients over time, or right away, sooner than later, sometimes due to the distrust, go seek second opinions.
How long did it take you to grow from 3 to 18 ops? That's a substantial jump.
10 years.
And was it, because there was a bajillion people moving in? Help me out.
No, actually, that practice that I had, I lived in Buffalo, New York at the time. And
okay.
It was Buffalo, New York. If anybody knows that area, it's like the test ground for sales of products, because the joke is if somebody buys in Buffalo, anybody anywhere will buy it. The average household income there was about $30,000. It wasn't anything like that. It was just I really attribute it to being blessed to do the right thing for the patient. And sometimes it didn't always feel right. Sometimes it hurt because patients will argue with you or whatever, but you got to stay true and you got to do what's right for the patient. Yeah.
Dr. Pasco, I think our audience would like to know, you went from here to here at the highest level of dentistry. What are some of those steps? What are some of those practice builders that you could share with our audience, please?
So I had a firm belief that I was going to build a practice that when people said dentistry, they thought of my practice. And that's what I had in my mind. I decided that, I wanted to be the biggest dentist office in Buffalo, New York. And I wanted to help, 10,000 people get their teeth back to good health. That was first and foremost. The second step then is making a commitment to something. And that's that second thing I did, is I made a commitment to that. So I learned, because in dental school, they don't teach us anything about business. I learned about the business aspect of dentistry. I learned about human beings because, while, dentistry is awesome and all the technology out there is awesome, there's still something attached to that tooth, and it's a living, breathing, thinking human being. And you have to know how to deal with that. So I made a commitment to learn business and to learn about people. And the third commitment I made on that was to learn about leadership and how to be a good leader and influencer, not only to my patients, but my staff, and also ideally the community as well. And one of the things I realized was I can't do it by myself. And I have to surround myself with the right people in the leadership roles, the technical roles, the administrative roles. I think at one point I had about 25 employees. Some of those employees were designated just to marketing. They were on the marketing team, and my new patient coordinator was considered to be part of the marketing team. We had a technical team, which was our clinical team. We had a management team. I even had like a follow-up team, someone who just kept quality control in, make sure everybody was doing everything correct. And if they didn't understand something, they would get the training or help that they needed. It's putting the right people in place. And I've given lots of talks about this, Barry. You can hire people, but if you don't place them right, then they're not really of much value to you. So understanding people and knowing what they do best and letting them do what they do best was really a big part of that. And then after that, it's really important, after you surround yourself with the right people, that you put in the right systems and the right organizational processes. that's the step that most dentists do wrong, is they put in the systems in the organizations. They want the easy button. They want templates. They want scripts. They want all this stuff. But if they don't have the right people in place and they don't know where they're going and they haven't made a commitment to going wherever it is they're going, then it doesn't matter what systems and organization you put in place. It's never going to work. And then I guess, Barry, the final step is what everybody really is looking for, which is your legacy, right? Like, what are you going to leave behind? I told you what my goal was for that practice, and I surpassed that goal big time. And I got to a point where now I knew it was time to turn it over. And that's what I did. I turned that practice over. I relocated. I started a new practice. I focused on helping other dentists be able to do the things that I was able to do with coaching and production coaching and things like that. Sometimes you have to start at the end to get to the beginning, right? So I think it's really important for any of the dentists listening out there. You got to know where you're going. Any good business plan starts with the exit strategy.
Well, you mentioned teams and really focusing on various systems in your practice. Let's go backwards a sec. Where, especially in these times, we'll frame it that way, where did you find these amazing human beings?
I didn't find them. We made them. Yeah.
Okay.
It's putting your trust and faith into the right people with good intentions, people who want to do the right thing, people who are loyal and committed. Is finding that right person, but also making them the right person as well. So they've got to have the basics in, right? They've got to have a good work ethic, and and then it's training them to do whatever it is that they're doing. For example, Barry, I had a treatment coordinator. She was responsible for reviewing the treatment plan and all of the finances associated with the treatment plan. And she was the best treatment coordinator I ever had. Her name was Erica. And she was so good at it. But before Erica was a treatment coordinator, she was like a cashier at a gas station. We were so impressed with her customer service just at a gas station, and just how helpful and happy she was and pleasant she was every time we went in, that we offered her, to come on in and check out the dental office and, see if she was interested in a career change. And she was. And she was very patient, very kind. That was her nature. But she, by no stretch of the means, had any experience in dentistry or in treatment coordination. But with some training, she took it on, and she did fantastic.
With regards to all of those systems that you had, which system do you think just was doggone near flawless? If you look back in the rearview mirror right now, you'd be like, yeah, that was a home run.
Your treatment presentation line, it has to be in order and in check, all the way from the diagnosis, the treatment planning, the case presentation. That all has to be very fine-tuned and very well organized. If it's not, and it varies and it gets confusing, or if you don't have the right tools or the right ways of communicating with your team so that everything flows smooth, the patient starts to feel uncomfortable. They start to lose confidence in your practice. One of the biggest things that you can put in your treatment presentation line, I guess, is just being quiet. I know that sounds really strange, but a lot of the times when I coach these dentists, they're talking through the treatment plan verbally while they're looking in the patient's mouth, and they're, maybe I could do this, maybe I could do that, maybe this. Please don't do that. Zip your lips. Do everything in your head. Not everything in your head has to come out through your lips, right? So we all know that. Use hand signals, use notes, whatever you have to do to sort yourself out. But don't talk it through with the patient, or in front of the patient, or with your staff in front of the patient. It doesn't work.
What would be the one system to tell our audience that, boy, that's the one that required the most attention, that was the problem child, if you will, or that was the one that we really had to revamp again, or kind of expound upon that, if you would?
I would say it was probably the training of your team to do things the way you want them done in your office. So, for example, how to answer the phone, how to schedule an appointment, how to pass the instruments, what to say, what not to say. That's something that never is done. It never ends, because even though someone really knows what they're doing, sometimes they still fall back to their old ways. And so constantly staying on top of that is probably the area of the practice that requires the most attention. And I think it's normal that that requires the most attention.
Dr. Pasco, you're known as the lifestyle dentist. Please expand upon your mission to our audience with regards to that, and how you have done that throughout the years, and what brings you the most joy.
As the lifestyle dentist, it can be misinterpreted. What the lifestyle dentist means to me is that you can go to work and you can do what you love to do. And when you leave work and you go home and you be home. And you're home with your family, your friends, your community. You can spend time doing things outside of the office that you love to do, and that helps people maybe even in another way. So there's some dentists who love to go on mission trips, or who love to work, at hospitals and volunteer their time. It should be something that you can comfortably do without feeling the pressure of your office. So when you leave your office, you truly leave your office. Most dentists don't want to do the business side of dentistry. I happen to really enjoy and love it, but most dentists don't. So they just want to go into the office, do dentistry, and leave. And that's exactly what they should do, and leave the business aspect up to somebody else that they can trust.
Is it more challenging when you go into a practice to work with the doctor or the staff?
The doctor is always the most challenging. Sorry. We're stubborn, and sometimes we think we know it all. And sometimes we're micro focused, which makes sense to me because that's what we're trained to do. But they have to be able to think of what the bigger picture is and what the next step is and what their legacy is going to be, and take themselves through those 5 steps that we talked about earlier, so that they can get to the end goal, which is probably to spend more time with their family, their friends, their community. So what I do is I go into a practice or I work with a doctor, and I really find out what it truly is that they really want. And then we help reverse engineer, so to speak, how to get there. Because the guy at the top, the doctor, usually no one is holding them accountable for anything. And so, it's nice to have somebody there to hold them accountable. And that's what I do.
So for our audience, let's say you walk in and it's January 1st. How long, on average, are you there? And how long does that take?
I usually go into an office for 3 days. The first day is purely observation. I watch what goes on in the office, how it's running, who's doing what needs improved. Sometimes I try real hard, Barry, not to jump in and get started right away, but sometimes I do. And then the second and third day is implementation. That's when we're putting in the systems, the organization, we're going over how things are going to be done. We role play a lot. And usually a lot of my role playing is with the doctor, and most of it's in the area of the diagnosis and treatment planning and presentation line. And then the staff kind of have their duties and their job functions that they're doing while I'm working with the doctor. And we kind of balance all that out.
So you do the 3 days. Then what happens after that?
After that, we do 6 months of follow-up. So I'll follow up with the doctor on a regular basis. That's the coaching aspect, where the doctor is held accountable for all the things that we talked about that, needed to be put in place or that need to happen, so that they can get to that end line where it is that they're going, what it is that they want to accomplish, so that they can have the lifestyle that they want.
When you go in, what is the number one problem that you just see everywhere? Like, boom. Like if I said, okay, you're going to this practice tomorrow, without even knowing anything about the practice, you'd say, okay, I know it's going to be X. What's X?
Well, the audience might not like to hear this, but I can't help but speak the truth. It's always the doctor. was there too once. I was stubborn and I thought I knew it all. And I thought, the number one problem I face is the doctor not being willing to look at themselves, look at the practice, be honest with themselves about themselves in the practice, and, agree to make some changes to be able to move in the right direction, whether it be holding on to staff too long or not wanting to discuss treatment with the patient, being too afraid that they're going to lose the patient as a friend rather, than keep them as a patient. Whether it has to be with finances, sometimes their finances are a mess and there's a lot of analysis that needs to go into that. They're spending way more than they're making. They're buying equipment that they don't really need at the moment because they can't even get the patient to say yes to getting their dentistry done in the first place. So we don't need fancy lasers and those types of things. And sometimes their schedule is just completely out of control. They have days where they're really super busy and not very productive, and other days, where, they have too much productivity and they're getting burned out and taking it out on the staff. And just watching sometimes in bigger practices, the quality control of the other dentists or the other staff, the training aspect for those staff that need the help. And then a lot of the times what's happening on their new patient line, what's happening with their marketing, what's happening, are the new patients coming in, are they staying, are they leaving, are people referring others, is the practice growing organically? Those are all things that the doctor has to be willing to take a look at and realize that the doctor is at the top of the castle and has built that castle. No matter how strong or weak that castle is, they're responsible for it. Yeah.
No, that's an outstanding analogy. Well, let me ask you this. You touched on marketing there. What types of marketing in 2022 do you find bear the most fruit?
Well, it seems to be tried and true for me, and I've been doing this probably since 2005, 2004, or 2005. Direct mail. Direct mail with the right message works the best. That's where most of our external new patients come from. And I say external because that's an external marketing resource. Secondary to that, externally, I would say that probably, the internet, the search engine optimization, and having someone who really knows how to do that well is really important. But I think first and foremost, the best form of marketing that you can have, and it's free, is internal marketing. How the practice is presented when the patient is inside the practice, because your best source of new patients, and still my number one referral source over any type of direct mail or other types of marketing, is word of mouth. That's a really great referral, because if someone sends in someone that they care about, that they love, or someone that they're friends with, it's a trusted, I'm already trusted from the beginning. And
Correct.
That makes things really easy from there on out. And they're usually the best patients. You can get tons of new patients, but are they quality new patients? And by quality, I don't mean tons of money or anything like that. It's patients who will trust you, and patients who, will invest into their health. And someone who understands that their mouth is part of their body, and that what you can do to help them in their mouth is going to help them overall with their total health. And that a dentist is more than just someone who spins a drill, but the dentist is someone who can save a life, because what we do inside the mouth helps the patient overall.
Okay, the spotlight is on you for rapid fire. Are you ready? Did you buckle up your seatbelt, Dr. Pasco?
I am buckled in, Barry. I'm ready to go.
All right. Dog or cat?
Cat.
Implant or bridge?
Oh, implant.
Italian food or Asian food? Your family's watching.
Italian.
Fall or summer?
Fall.
Captain America, Batman?
Batman, definitely.
Baseball, football?
Oh, football.
Beach or mountains?
Mountains, definitely.
New York style pizza or Chicago style pizza?
Ooh, that's tough. I have to do New York. I like it thin.
Mall or online?
Ooh, neither.
Send somebody else.
I'm not a big shopper, but
Endo or extraction?
oh my gosh. As far as what I like, extraction.
You survived.
I did. Is that
You
it?
survived. So if you don't like the mall or you don't like online, how do you get stuff?
I know, right? I'm not a big shopper.
Okay.
Like the mall is just too much for me, and online there's too many choices. So I end up not buying anything at all.
All right. Dr. Pasco, fabulous having you here today. You are an absolute rock star in our profession. It has truly been an honor and a pleasure to pick your brain a bit and share with our audience what makes you so special and valued in our field. We're just delighted to be a part of that. So appreciate you so much, how much you taught us today and how you continue to grow and shared that with us. Before we go, is there a way for our audience to get in touch with you if they'd like?
Oh, sure, absolutely. If anybody has any questions or needs any help from me, the best way to get in touch with me would be via email. And that would be Dr. Leslie Pasco at gmail.com, all lowercase, no periods, just Dr. Leslie Pasco at gmail.com. That's the quickest, fastest, best way to get in touch with me.
Outstanding. Well, we very much appreciate you, not only just having you as a guest, but as a fellow practitioner. What a gift you are to our profession. Thank you so much.
Well, thank you, Barry. Thank you very much for having me here today. I had a lot of fun with you, and I really appreciate you as well.
Our pleasure. Be well.